Today is Tuesday, July 23rd. We had our insemination on July 4th. We were told to wait 16 days before taking a pregnancy test, and on the 15th day, the night before the 15th day, so on the 14th day, Adam and I had talked about it, and most times after an insemination or after conceiving, you call it the 2-week wait because you wait for 2 weeks before finding out whether or not you're pregnant. So we decided that, we would test on the 15th day instead of the 16th. One day, it doesn't make a big difference. So we decided on doing that. The morning of that day, which was Friday, July 19th, so 4 days ago, Adam had to get up early to go to the DMV, and the second his alarm clock went off, I was wide awake. My heart immediately started pounding, and I couldn't fall back asleep. I had to tell myself to stay in bed and not rush to the bathroom to take a test. And finally I couldn't wait anymore, and I was going through different ways that I would surprise Adam when he got home from the DMV. But instead, I started my period. I peed on a stick, not knowing that at the time. And we found out that I was not pregnant. And it was really, really difficult this time because I think in trying to stay positive and, put these positive things out there, we kind of got our hopes up a little bit too high. And it was a big disappointment this time. I took the day to feel those emotions and be angry and just wonder if there was something that I could have done differently, but I know that there's not. I decided not to take the letrozole. It's still July, but we'll call it for the month of August because, I'm assuming that I'll be ovulating on the left side, so we wouldn't be able to do an insemination anyway. And also, I've been experiencing more and more symptoms with the letrozole, so I decided to give my body a break. On August 8th, we have a phone appointment with our fertility doctor to go over what they call the next steps. I've now had 4 medicated cycles. We've only had 2 inseminations, but usually after the 3rd medicated cycle, they set up a next steps appointment with your fertility doctor to kind of talk about and go over what you're going to do next if this continues not to work. So Adam and I have talked about, possibly not trying IUI again and just going straight for IVF. We have read reviews about the IVF clinic in Fremont, the Kaiser IVF clinic, and also, looked into some local IVF clinics. We're going to wait until we speak with our doctor in a couple of weeks to really make a final decision about what we want to do. Since we've only done the insemination twice, part of me wants to try it at least one more time, maybe 2 more times. it's just so hard, especially in our situation. We only have, generally we only have the ability to try an insemination every other month. So, there's pros and cons to that. The pro is that, obviously the month of July has been very difficult, not being able to get pregnant. So that kind of gives us August to, let my body, kind of breathe a little bit, and our emotions. But that just means it's going to take longer, The earliest that we could try again is September, and then after that, November, if we continue with the IUI. So that's a little challenging, but it gives us time to weigh our options and think and really make, a solid decision. So I was hoping for better news. You get these pictures in your mind of the perfect outcome and the way that you think things are going to happen. And it's just hard being let down. This is our 16th month of actively trying to become parents, and it just doesn't get any easier. And I just feel so much for other couples that are going through things like this. So hopefully one day I'll be able to help you. And until then, we'll just keep pushing along and hope that our miracle's coming. I keep saying that, but it will. It'll just take a little longer. Today is Wednesday, August 21st, and since my last update, when we found out that I was not pregnant, we had a phone appointment with our fertility doctor, and I was nervous. I didn't know what he was gonna say, or it's technically called the next steps appointment, and that is apparently after 3 medicated cycles, which is where you take prescription medication to help you produce more than 1 egg at a time. After 3 medicated cycles, they like to do a next steps appointment, even though we had only done 2 inseminations at that time. Our fertility doctor, who has been so fabulous through all of this, this is only the second time we've talked to him, but Adam and I both agree that after every time we talk to him, we both just feel so much more positive and optimistic, and he's very reassuring and helpful, and he always asks if what he's explained to us, if he explained it well, if we need clarification. So we really appreciate him. Shout out to Dr. Nelson. He'll never watch this, I'm sure, but we appreciate you. So pretty much the way that he explained it to me is that we can, and he suggests that I disconnect my blocked fallopian tube. And it's not doing me any good. It's not going to do me any good. They tried to reopen it. They couldn't. So, if it's causing us if it's keeping us from getting pregnant, just take it out. When I did research after this conversation, I realized that when he said disconnect the fallopian tube, he meant remove it. And I think he used the term disconnect to keep from kind of scaring me, because it is a little scary thinking that something that for women that can get pregnant naturally, something that's so important in that process, like you're gonna take that out. But again, it's not helping me. At this point, it could be keeping me from getting pregnant. So we have decided to go along with that. And when this phone appointment was scheduled, I wanted to talk to Dr. Nelson about doing a laparoscopy because ever since I was young, we have thought that I possibly have endometriosis. And I've been worried that the endometriosis is what has been keeping me from getting pregnant. Doing a laparoscopy is the only way to confirm whether or not a woman has endometriosis. So, that was like the first thing I brought up to him, was doing this laparoscopy. And he said, I think that's a great idea, but not only do we want to check whether or not you have endometriosis, but we should disconnect this tube. So we decided, yes, we would like to do the laparoscopy. Yes, we'll disconnect/remove the tube. The scary thing was that he said, if I do in fact have endometriosis and there is any damage to my right tube, which is my good tube, that they haven't been able to see on any of the other tests, that they may or may not need to also remove that one. And if that's the case, then the only way I'll ever get pregnant is through IVF, which is okay. I mean, we are so grateful and thankful that that's an option for us. And if that's the case, then, we'll take that path when the time comes. Another thing that I asked him was, are there tests that we can do before IVF to see if it's even possible for me to get pregnant? Is there something wrong with my uterus, which has been a big worry of mine. He confirmed that through all of the testing that I've done, all of the ultrasounds, through all of my cycles with the IUI, the MRI that I did, he confirmed that my uterus is good to go. And I am very, very, very relieved and happy about that, because that is where I will grow my baby. Because I am capable of getting pregnant and having a baby. I have to keep telling myself that. So I was really, really happy to hear that my uterus looks good. And like I said, it was really relieving. So Dr. Nelson put in a note for the surgeon in San Francisco, and the surgeon got back to us. She scheduled a consultation for this surgery. We'll just go over the process, probably what I have to do for pre-op. Hopefully, they'll tell me how long recovery will take, and I'm not sure exactly what else we'll talk about, but I'm excited to figure out what we're going to do next. So we've been extremely busy. Adam and I have been extremely busy these last couple of weeks, which is why I haven't really done an update. None of it has been fertility related, and I'm kind of okay with that, because this whole process is very exhausting and emotionally draining. So it was nice to kind of take a break for a little while. We have not and will not do any more of the IUI until after this surgery, because if Dr. Nelson thinks that this is what's kind of keeping us from getting pregnant, then it's kind of pointless to keep trying. Depending on what we find in the laparoscopy and the quality of my right fallopian tube, we may or may not try the IUI again. It just depends on, there's a lot of variables, so it depends on what do we find. I'll do that next update after we meet with the surgeon. 2 weeks from yesterday, we'll meet with the surgeon and hopefully figure out what we got to do next. All right, today is Wednesday, September 11th. It has been close to 3 weeks since my last video, because we have been extremely busy. There's been a lot going on since then, and I kind of was explaining what Dr. Nelson, who is our fertility doctor, what he suggested our next step is in regards to getting pregnant. He explained that sometimes fluid can get caught in a blocked fallopian tube, and we met with our surgeon last week. We met with her on the 3rd, and she explained further that not only can fluid get caught up in your blocked tube, which will cause an increase of pain, but some of that fluid somehow can be secreted back into your uterus, and that will kill an embryo. What surgeons can sometimes do, I guess, is they can create a barrier between your blocked fallopian tube and your uterus, but it's doing me no good. There's no way they can reopen it. So I said, let's just take it out. That's the safer way to go as far as making sure that there is no harmful environment for a potential embryo. When we met with our surgeon, she was extremely nice, explained everything very well, even showed Adam and I pictures of the procedure that she'll be doing on me. She will be removing my left fallopian tube. Once that is complete, she'll then look for any endometriosis lesions and either remove those or use a laser to remove them. And then she showed us a picture of a uterus before, taking all of the endometriosis off, and then after, and it's a huge difference. She'll remove any cysts or anything that she finds that's kind of being intrusive. And then she'll put this mesh barrier around my uterus that will like melt into it, which is a good thing. It's to prevent any further scar tissue from forming on the outside of my uterus. So she won't be coming in contact at all with the inside of my uterus because as far as we know, everything looks good there. So she is going to be checking my right tube to make sure that there's no damage on that side. She'll only remove my right fallopian tube if she finds what she called a hydrosalpinx, which is the problem on my left tube and the reason for the blockage. So when she had explained all of that, she said, so when are you looking to, get this surgery? And I said, well, Adam and I have been trying for almost 2 years. We would like to do it as soon as possible. Now, this was on September 3rd. She said, usually we're booked out a month or two, but we have this opening on September 13th. And I was like, well, that's great. She's like, it's Friday the 13th. And I was like, that's okay. Like, I'm not superstitious to that extent. And if anything, this has given me the opportunity to get in quickly and get this taken care of. And, if other people don't want to, that's fine, but it's not a big deal to me. I'm not afraid of it or anything like that. So I'm going to use this day to my advantage and get this all taken care of. So that's in 2 days. I'm glad that the short amount of time between the consultation and the surgery has given me less of an opportunity to think about all of this, to worry about it. Most of me is very excited. Obviously there's some risks and some nervousness about, getting surgery, but, most of me is so excited for what's to come after this. This is, I feel like, is a big piece of our puzzle. It could be one of the last pieces. So I'm so excited. She let us know that the surgery itself could take 1 to 2 hours. And then, the process of me waking up and being alert could take another hour or two. So the full amount of time that I'll be, back there will be anywhere from 3 to 5 hours. And I've had surgery before. I've been under anesthesia, and it's not taken any weird effects on me. So I think I'll be fine in that way. I don't have to spend the night at the hospital. I get to come home, and I am said to rest for up to 2 weeks. So there will be lots of Halo Top ice cream and Netflix. We asked the surgeon, once we get the surgery, when can we start trying again? And she said we could start trying, right away, since there's no actual, there's nothing that she does inside my uterus. But sometimes fertility, your actual fertility doctor will want you to wait a month or two because the stress of the surgery can sometimes throw off your cycle. So I had emailed our fertility doctor, Dr. Nelson, to let him know that, we set up the surgery date. He's been out of the office. I think he's back today, but I haven't heard from him yet. So we will see where we go from there. I'm thinking that if everything is taken care of, everything looks good, and my right tube is still, good to go, we may try IUI a couple more times. And But we do want to talk with Dr. Nelson and see, you know, what is our best case scenario. So we'll just go from there. I'm really looking forward to it. And maybe I'll do another update after the surgery.